Love when my doctors come in, the 55KRC Morning Show. OHC, the cancer specialist, my cancer doctors for my lymphoma. Thank God I don't have colorectal cancer, but apparently I may very well be able to get it. In studio, one of the awesome doctors at OHC, Dr. Mark Johns, who is a medical oncologist and hematologist who treats solid tumors, including colorectal cancer, through standard and groundbreaking treatment options offered at OHC, including clinical trials, which we'll probably hear about this morning. He's the principal investigator for gastrointestinal, prostate, and genitourinary clinical trials at OHC. Strongly believes in the power of providing her patients with the latest revolutionary therapies available. That's a theme at OHC, and I've gotten wonderful treatment there. Welcome to the studio. It's a pleasure to have you in here, Dr. Johns.
Oh, thanks for having me.
All right. Why are we seeing more colorectal cancer in younger people? And I had asked you off air, and you told me to at least bring it up on air, so here I am. Is it possible that it's the vast amount of ultra-processed fast foods? And I was telling you about when I was a kid, you can easily draw a contrast between what it was like in 1975 and here we are in 2025. I have like 9,000 more fast food alternatives, and it's all ultra-processed. Is that part of it?
So that's a great question. Every year you ask me, and every year we say it's something in the gut microbiome, it's something in the diet, it's something in our lifestyle, and we can never really put our finger on it. And we still don't quite know the answer, but I did find something interesting and something I wanted to share with you. There was a study that was presented at ASCO, got a standing ovation, and then was published in the New England Journal of Medicine this summer. And I thought I'd share it with you. It's called the Challenge Study. And what the investigators in the Challenge Study showed is they took patients with high-risk colon cancer, so colon cancer that had spread to the lymph nodes already primarily, and everybody had surgery, everybody had standard of care, second-generation adjuvant chemotherapy, what we call FOLFOX chemotherapy. Half the patients, they got educational materials like a pamphlet. It said, here, you should lead a healthy lifestyle. The other half, they were randomized to supervised activities, so an exercise regimen, and they followed these patients closely. The patients that exercised, they lived longer. And they didn't live longer because they had fewer strokes and fewer heart attacks. They lived longer because they had better cancer outcomes. So the cancer actually showed back up in the liver less often, okay?
This is the metastasize. I mean,
Correct,
you have it in the colon, and they may be able to cut that out, but if it metastasizes, it's going everywhere.
Right. So that's the first place it typically goes to is the liver. And a major risk factor for having colon cancer is having had it in the past. These patients developed fewer second colon cancers. The men, they got less prostate cancer. The women, they got less breast cancer. How much less? Okay.
Yeah.
So when you go back with first-generation chemotherapy, 5-year disease-free survival, so the chance of being alive without your cancer back, it was about 67% with first-generation chemo. And it was a revolution when we changed to the second generation called FOLFOX, 73%. Now, by adding exercise, the group that just got the pamphlet, they got the same 73% 5-year disease-free survival. With exercise, 80%. What that means is that exercise added more to disease-free survival than did the last major evolution of our adjuvant chemotherapy regimen.
That's amazing.
If it was a drug, it would be FDA approved. Everyone needs to get back out there, and they need to start exercising. I think that's part of what's changing. We've become sedentary as a society.
So, yeah, ultra-processed food bad, and maybe one of the reasons you have colorectal cancer increasing, but obviously we are so much more sedentary given the computer screen existence that we all have.
Absolutely. And so what they showed here is they sought to increase activity by what's called 10 MET hours per week. A MET hour is the amount of energy you burn just sitting in a chair completely unstimulated for an hour. To do that, it's just a 20-minute brisk walk every day.
And you know what, doctor? As I sit here today, and I feel embarrassed because I'm that lazy guy, and I'm feeling a little concerned about going home today because my wife regularly listens to the morning show. And I know I'm going to hear your words back to me when I get home today. So,
take her for a walk.
I know. Okay. All right. But it is the leading cause of all cancer deaths in men under 50. And the second leading cause for women of all cancer deaths, it's colorectal cancer now.
Oh, absolutely.
All right. All important. What symptoms should, I would think everyone, but now younger adults be watching for?
Sure, we talk about blood in the stool, a change in the caliber of the stool, abdominal pain, weakness and fatigue from anemia. Kind of the important thing to keep in mind is that you can be completely asymptomatic and have colon cancer, and that's why screening is so important.
Okay. And at what, well, younger people are now getting colorectal cancer at a much younger age. So when does the screening kick in? Because it used to be what, 45 or 50
It used to
before
be
you needed it?
50, and now we've dropped it down to 45 years of age. So the incidence of colon cancer is about 10 per 100,000 in the 30s. It more than doubles by the late 40s. So between 45 and 50, it's probably about 25 per 100,000, and it keeps going up from there.
And how often does one need the screening? I know mammographies are represented or are expected on a certain regularity. So getting the colonoscopy, how often?
Sure, colonoscopy is every 10 years. If you choose to do Cologuard, that's every 3 years. If you use the Guardant Shield, that's also every 3 years.
In your experience, given your level of expertise as a cancer specialist, is 10 years often enough? How long will it take for a cancer to actually develop? I mean, you find a polyp when they're doing your colonoscopy, and they take that out, and that could turn into a cancer. But how? I mean, can it pop up very quickly right after that, aggressively? I mean,
It can, but what tends to happen is that if they don't find anything, they'll tell you 10 years. And if your gastroenterologist finds polyps, then they'll bring you back more quickly. If you have an inherited cancer syndrome like HNPCC or the Lynch syndrome, it's called a non-polyposis syndrome because apparently the mucosa goes from normal to invasive cancer very quickly. And so we want to find those people through genetic testing, and then we do colonoscopy more frequently, like every 1 to 2 years in those patients.
okay, given my lymphoma, I regularly seeing one of the OHC doctors, and I get my blood screened several times a year, and I get CT scans, and so they're really right on top of it. But in terms of blood screening, is that a way of identifying? Is there any blood work that can be done that might suggest that you need a colonoscopy or that it could be colorectal cancer?
Yeah. So there's the Guardant Shield, which is a cell-free DNA assay,
Okay.
and it is FDA approved for screening for colon cancer. It has diminished sensitivity for detecting advanced precancerous polyps, but if you have established invasive cancer, it's pretty good at detecting that. It's also plagued, just like Cologuard, with some degree of false positives.
All right. Now, pivoting back to young people, we've already talked about regular exercise, so that's on the short list to prevent colorectal cancer. What else is on the short list?
Avoid cigarettes. Cigarettes increase the risk of colon cancer by 50%. Heavy alcohol increases the risk of colon cancer by 30%. Processed meats by 20%. Excess red meats by 10%. So eat a diet high in fiber. Avoid those. Get your screening colonoscopy.
And alcohol is one of the things that it seems to me, and it only recently started being a focus of cancer. When I was young growing up, and I'd say only within the last 10 years have I read that excessive alcohol consumption can cause cancer.
Right. We used to say, a glass of wine was okay. Now we've really kind of curtailed that.
All right. Knowing your family history, I see, is there a genetic test that OHC offers that helps you provide that foundation?
Oh, we
Is that one you
absolutely
just
do.
talked about?
Yes, yes. So we have genetic testing at OHC. You do not have to have been diagnosed personally with colon cancer or any cancer to be tested. You would just simply give us a call at 751-2273 or 888-649-4800 or visit our website at ohcare.com, and we can get you in and get you tested.
All right. I usually end on it, and so I'll end on it today, Dr. Johns. Clinical trials. That's usually where the cutting-edge therapies are being offered. And I know you always offer them at OHC. How about for colorectal cancer?
Oh, absolutely. We talked about a tumor vaccine last year. That trial's closed, and we're waiting to see if that was of any benefit. This year, we have a randomized phase 2 trial of a drug called Telisotuzumab adesatecan, which is a mouthful.
Okay.
What it is, it's an antibody drug conjugate. It's an antibody directed towards something called c-Met that's present on the surface of advanced colon cancer cells. And it brings the chemotherapy right to the colon cancer cell. And we're looking at adding it to standard of care first-line therapy for stage 4 colon cancer. So if you or a loved one has been diagnosed with colon cancer that has spread out of your colon into other parts of your body and you haven't yet received treatment, we'd love to hear from you.
So it acts kind of like a magnet?
Yeah, absolutely. We have other drugs like that. This drug has an accelerated approval, actually a drug similar in non-small cell lung cancer, and we're hoping it revolutionizes colon cancer the same way.
Always on the cutting edge of things cancer-related. OHC. Find them online at ohcare.com. The number is 888-649-4800 for a first or second opinion. 888-649-4800. Dr. Mark Johns, thank you for all the valuable information and keeping this in front of our minds. And we'll now have to start thinking about our young people, but diet and exercise apparently are real key.
Absolutely.